Imagine walking into a doctor's office, expecting reassurance about your health, only to leave feeling more anxious, stressed, or even worse, end up undergoing unnecessary tests that could harm you. Sounds scary, right? But for many seniors, this is a hidden reality. After 70, not every health checkup is helpful. Some can actually do more harm than good. Today, we're uncovering the 5 health checkups you should think twice about before agreeing to, and what smarter alternatives exist to protect your health as you age. As we age, our bodies change in ways that make certain routine screenings less beneficial, and in some cases, risky. The first one on the list is the full body cancer scan. These scans promise to detect cancer early, but in reality, they often identify slow-growing tumors that may never actually affect your health. This can lead to unnecessary biopsies, radiation, or surgery, which can be physically and emotionally taxing for someone over 70. Studies show that the stress and complications from these aggressive interventions often outweigh any potential benefit. Instead, focusing on regular checkups with your primary doctor and addressing symptoms as they arise is far safer and more effective. Next, many seniors are encouraged to have routine heart stress tests even without symptoms. While these tests can detect heart issues in younger adults or high-risk individuals, for healthy seniors with no cardiac symptoms, the results can be misleading. False positives are common, leading to invasive procedures like angiograms or stents that carry real risks, bleeding, infection, or even heart attack during the procedure itself. The smarter approach: maintain regular blood pressure checks, monitor cholesterol and heart health naturally through diet, exercise, and medication only when clearly needed. Then there's the prostate-specific antigen test for men. Once a routine part of yearly exams, research now shows that after 70, PSA tests often detect slow-growing prostate cancers that may never cause problems. The treatments following a positive result, such as surgery or radiation, come with side effects like incontinence, erectile dysfunction, and significant stress. Many older men end up being treated for cancers that wouldn't have affected their quality of life at all. A personalized discussion with your doctor, weighing risks and life expectancy, is far more important than an automatic yearly PSA test. Another one to be wary of is routine bone density scans for everyone. Regardless, osteoporosis is a concern as we age. Not every senior needs repeated scans. Over-testing can result in unnecessary medication, which may have side effects like joint pain, digestive issues, or even rare fractures with long-term use. Instead, bone health can be maintained through weight-bearing exercise, vitamin D, calcium intake, and targeted screenings based on your actual risk factors like previous fractures or long-term steroid use. Finally, let's talk about full-body lab panels that include every possible blood test. Many seniors are encouraged to run extensive panels every year, checking everything from thyroid levels to liver enzymes. But these tests can often detect minor irregularities that are completely harmless, triggering unnecessary follow-up tests, anxiety, or even treatments. Over-testing can actually lower your quality of life without improving your health outcomes. A more effective strategy is to focus on key tests based on your history and symptoms rather than a blanket approach. The truth is, many seniors undergo these checkups thinking more testing automatically means better health, but the reality is far more nuanced. Imagine Mr. Thompson, a 72-year-old retired teacher, who went in for a full body cancer scan because his friends recommended it. The scan flagged a tiny, slow-growing tumor in his kidney. The doctors suggested surgery just to be safe. After a complicated procedure, he faced weeks of recovery, significant discomfort, and ongoing anxiety, only to learn that the tumor was harmless and likely would never have caused problems. Stories like his aren't rare. They highlight why over-testing can sometimes do more harm than good. Another example is Mrs. Patel, 75, who insisted on annual PSA tests. One year, her levels were slightly elevated, triggering a biopsy. The procedure left her with pain and fatigue for weeks, and she had to endure months of worry before doctors concluded that the findings were minor. Had she focused on symptom-based monitoring and regular check-ins with her physician, she might have avoided that stressful ordeal entirely. So what's the smarter approach? It's about personalized health care. After 70, your medical decisions should be guided by your overall health, life expectancy, and personal priorities, not by a blanket checklist of tests. Doctors now emphasize shared decision-making, where you and your healthcare provider weigh the benefits and risks of each test. For example, instead of a routine full-body scan, you might focus on maintaining heart health through exercise, monitoring blood pressure, and managing cholesterol. Instead of automatic PSA tests, you might only test if there are concerning urinary symptoms or changes in overall health. Lifestyle choices become even more important at this stage. Walking, gentle strength training, balanced nutrition, adequate sleep, and stress management can often have a bigger impact on longevity and quality of life than many routine screenings. Preventive care still matters, but it should be targeted and sensible. Vaccinations, annual flu shots, monitoring blood pressure, and checking vision and hearing are simple, safe ways to protect your health without overloading your body with unnecessary interventions. It's also crucial to be aware of the psychological impact of over-testing. False positives, minor irregularities, and inconclusive results can trigger anxiety, sleep disturbances, and even depression in seniors. Mental health is just as important as physical health, and avoiding unnecessary checkups can help preserve both. A calm, measured approach to medical care allows you to focus on living well rather than constantly worrying about what the next test might reveal. We're building a clear picture. It's not that checkups are bad after 70, it's that not all checkups are created equal. Part of aging smartly is knowing which screenings genuinely improve your health and which may only increase stress, risks, and complications. If you're ready, I can continue with part 3, where I'll go deeper into alternative strategies, tests that are actually useful after 70, and practical daily tips for seniors to stay healthy and independent. Now let's shift the focus from what to avoid to what truly matters after 70. While some routine screenings may do more harm than good, there are several smart, targeted checkups and strategies that can genuinely protect your health and maintain your independence. First, regular blood pressure monitoring is essential. High blood pressure often has no symptoms but is a major risk factor for heart attack, stroke, and kidney disease. Unlike broad, unnecessary tests, this is simple, non-invasive, and actionable. Even a small adjustment in diet, exercise, or medication can dramatically reduce risk. For seniors, checking blood pressure at home or during routine doctor visits can prevent serious complications without the downsides of over-testing. Next, diabetes screening remains important, especially if you have risk factors like obesity, family history, or high blood pressure. Blood sugar issues can sneak up silently, leading to fatigue, infections, or nerve problems. But instead of running excessive panels every month, a targeted HbA1c test or periodic fasting glucose check is usually sufficient. This way, you stay informed without overwhelming yourself with unnecessary procedures. Another area to prioritize is vision and hearing tests. Losing sight or hearing can drastically affect quality of life, increasing the risk of falls, social isolation, and depression. Unlike aggressive imaging tests, these screenings are safe, quick, and actionable. Early detection can help with glasses, hearing aids, or other interventions that maintain independence and safety. Vaccinations are another smart, targeted preventive measure. Flu shots, shingles vaccines, and pneumococcal vaccines protect against infections that can hit seniors harder. Unlike many overused screenings, vaccines are low-risk, evidence-backed, and highly effective at preventing serious illness. Staying up to date can mean the difference between a mild infection and a hospitalization. Physical fitness and mobility checks are equally vital. Even a short walk, light resistance training, or balance exercises can prevent falls, maintain muscle mass, and support heart health. Simple functional assessments during doctor visits, like walking speed, grip strength, or balance tests, give more actionable insight than some high-tech scans that might detect problems that aren't really dangerous. Nutrition also plays a surprisingly big role. After 70, metabolism slows, protein needs increase, and bone health becomes more fragile. A diet rich in vegetables, lean protein, whole grains, and healthy fats can protect heart health, support muscle maintenance, and improve energy levels. Consulting with a dietitian or even following a simple balanced plan is far more impactful than chasing every lab result that may appear normal but has little clinical significance. Finally, it's important to review medications regularly. Polypharmacy, taking multiple medications, is common in seniors, and some prescriptions can cause side effects, interactions, or complications that mimic health problems. Regularly evaluating which medications are truly necessary can prevent unnecessary symptoms, hospital visits, and stress. By focusing on these targeted strategies, blood pressure, diabetes screening, vision and hearing, vaccinations, mobility, nutrition, and medication review, you're choosing tests and routines that genuinely improve your health without the stress, cost, and risk of unnecessary procedures. We're now at a point where viewers will understand not only what to avoid, but also how to proactively protect their health after 70. If you want, I can continue with part 4, where I'll explore common myths seniors fall for, how to have smarter conversations with doctors, and real-world examples of avoiding unnecessary tests while staying healthy. Despite all the evidence, many seniors still fall for common myths about health screenings. One of the biggest myths is that more tests automatically equal better care. This mindset can lead to stress, unnecessary procedures, and even harm, especially after 70. It's easy to think that a full body scan or yearly PSA test is essential, just in case. But as we've seen, these tests often detect issues that would never affect your life, leading to worry and interventions that can do more harm than good. Another myth is that age alone justifies every possible screening. While aging increases risk for certain conditions, not every test is equally useful for every person. Your individual health status, lifestyle, and priorities matter far more than simply following a checklist. For example, a healthy, active 72-year-old with no heart symptoms likely does not need a stress test, but someone with diabetes, high blood pressure, or chest pain might. Understanding this distinction is critical for smart, safe aging. So, how do you navigate this minefield? Communication with your doctor is key. Don't hesitate to ask, will this test actually improve my health or quality of life? Or, what are the risks if I skip it? A good doctor will personalize recommendations based on your health history, current condition, and life expectancy rather than following rigid guidelines. Seniors who actively participate in these discussions often avoid unnecessary procedures while still staying protected against real health risks. Let's look at a real-world example. Mrs. Garcia, 78, was encouraged by a friend to get a full-body cancer scan. Instead of rushing into it, she spoke with her physician about her overall health, family history, and recent lab results. Together, they concluded that targeted screenings based on symptoms, like a mammogram or colonoscopy when appropriate, were far safer and just as effective. Mrs. Garcia avoided the anxiety and potential complications of an unnecessary scan while still keeping her health in check. Another tip is to track your own health trends. Keeping a simple log of blood pressure, weight, energy levels, and any new symptoms helps your doctor make informed decisions without relying solely on aggressive screenings. This approach empowers you to notice real changes and address them early without undergoing tests that may offer little benefit. Lastly, consider quality of life as a guiding principle. After 70, health decisions should balance longevity with comfort, independence, and joy. If a test carries a significant risk, requires invasive procedures, or could cause unnecessary stress without a clear benefit, it's worth questioning. Choosing wisely doesn't mean ignoring your health. It means prioritizing the screenings, habits, and interventions that truly improve your life. At this point, your viewers understand the pitfalls of unnecessary testing, the myths to avoid, and how to actively participate in smarter, safer healthcare after 70. If you want, I can continue with part 5, where I'll provide practical daily tips, a simple preventive checklist, and final actionable advice for seniors to thrive without over-testing. Let's wrap up with practical, actionable strategies that seniors can use every day to protect their health without falling into the trap of unnecessary testing. First and foremost, move your body regularly. Even light exercise like daily walks, gentle stretching, or chair exercises supports heart health, maintains muscle mass, improves balance, and reduces the risk of falls. Consistency is far more important than intensity at this stage. Next, prioritize nutrition. A balanced diet rich in vegetables, fruits, lean proteins, whole grains, and healthy fats strengthens immunity, bones, and muscles. Adequate protein intake is especially important for preventing muscle loss, while calcium and vitamin D support bone health. Small, sustainable changes, like adding an extra serving of vegetables at lunch or including a protein-rich snack, can have a major impact over time. Sleep and stress management are often overlooked but crucial. Poor sleep can worsen memory, mood, and overall health, while chronic stress can elevate blood pressure and inflammation. Simple practices like establishing a consistent sleep schedule, practicing deep breathing, or spending time in nature can make a big difference. Routine self-checks and symptom tracking are another key tool. Paying attention to changes in energy, appetite, weight, or mobility helps you notice issues early without relying on broad, unnecessary tests. Documenting these changes allows your doctor to focus on what truly matters for your health. Social connections and mental engagement also play a critical role. Staying connected with friends, family, or community groups supports emotional well-being, reduces feelings of isolation, and even helps protect cognitive function. Simple activities like reading, puzzles, volunteering, or taking up a hobby can keep the mind sharp and boost quality of life. Finally, remember the golden rule: after 7 choose tests and interventions that improve your quality of life, not just your numbers. Focus on meaningful health markers, maintain regular but targeted checkups, and have open conversations with your doctor about risks versus benefits. By doing so, you avoid the pitfalls of over-testing, unnecessary stress, and procedures that can do more harm than good. Adopting this approach allows seniors to age with confidence, maintain independence, and enjoy life fully without being trapped in a cycle of endless, potentially harmful screenings. Smart healthcare after 70 is about balance, protecting yourself from real risks while avoiding tests that offer little benefit and may cause harm. As we reflect on all of this, it's clear that aging gracefully isn't about running every test available or chasing every number on a lab report. It's about making thoughtful choices, staying active, and focusing on what truly matters for your health and happiness. After 70, your time, energy, and well-being are precious, so every decision should add value to your life rather than unnecessary stress. One of the most powerful tools you have is knowledge. Understanding which checkups are truly necessary and which may do more harm than good empowers you to advocate for yourself. Don't be afraid to ask your doctor questions. Seek second opinions or request alternative approaches when a recommended test seems excessive. Knowledge gives you control, and control reduces anxiety and risk. Another key takeaway is the importance of balance. Some screenings are essential, like blood pressure checks, diabetes monitoring, and vaccination, but many routine tests, if done indiscriminately, can lead to overdiagnosis, invasive procedures, and complications. Balance means knowing which tests protect you, which lifestyle habits matter most, and when it's safe to say no to unnecessary interventions. Part of this balance is also mindful living. Staying socially connected, mentally active, and physically mobile contributes more to long-term well-being than a scan or blood panel ever could. It's the small, consistent habits, walking with a friend, eating a nutrient-rich meal, doing a short stretching routine, that truly make life after 70 vibrant, independent, and fulfilling. Finally, remember that healthcare is a partnership. Your doctors, caregivers, and family are there to support you, but you are the one living your life. Being informed, asking the right questions, and choosing wisely ensures that your medical decisions align with your values, priorities, and quality of life. By embracing this approach, seniors can confidently navigate the complex world of medical testing, avoid unnecessary harm, and focus on what really matters, staying healthy, active, and happy for many years to come. If you want, I can now write the powerful, engaging conclusion that ties all 6 parts together, leaving viewers motivated and informed. Now, let's turn all this information into a practical roadmap you can use every day. Think of Part 7 as your senior health survival guide. Simple, actionable steps to stay healthy without falling into the trap of unnecessary tests. Start with your essential screenings. Focus on what truly matters: regular blood pressure checks, targeted diabetes monitoring, vision and hearing tests, and up-to-date vaccinations. These are proven to improve health outcomes, reduce risks, and keep you independent longer. Next, build daily habits that protect your body. Walk, stretch, or do gentle strength exercises. Move every day, even for just 20-30 minutes. Small steps add up, and consistent movement supports your heart, bones, balance, and mood. Pair this with mindful nutrition, plenty of vegetables, lean protein, whole grains, and healthy fats. Avoid overly restrictive diets that may do more harm than good. Focus on balance and sustainability. Don't forget mental and emotional health. Stay socially connected. Challenge your brain with puzzles, reading, or hobbies, and practice stress reducing techniques like meditation or deep breathing. Emotional well-being is just as vital as physical health, and it often improves every other area of your life. Track your health intelligently. Keep a simple log of blood pressure, weight, energy levels, and any new symptoms. Share it with your doctor to make decisions based on real trends rather than unnecessary screenings. This empowers you and reduces anxiety over small, harmless changes in lab results. Finally, embrace the mindset that quality matters more than quantity. Not every test, scan, or panel will extend your life or improve its quality. Choosing wisely, asking questions, and focusing on meaningful habits ensures that your years after 70 are not just longer, but better, full of energy, independence, and joy. By following this roadmap, seniors can confidently navigate healthcare decisions, avoid unnecessary interventions, and prioritize the things that truly make a difference: movement, nutrition, social connection, mental sharpness, and safe, targeted medical care. If you want, I can now create a fully polished, flowing version of the entire script, combining all 7 parts into one continuous narration ready for recording, optimized for timing, pauses, and storytelling. In the end, aging doesn't have to mean endless tests, worry, or unnecessary procedures. After 70, the smartest approach to health is about choices, balance, and quality of life. Avoid the screenings that may do more harm than good. Focus on targeted, evidence-backed checkups, and embrace daily habits that truly strengthen your body, mind, and independence. Remember Mr. Thompson and Mrs. Patel. Their stories remind us that not every test is a life-saver, and sometimes saying no is the healthiest choice you can make. By moving your body, eating well, monitoring key health markers, and staying connected socially and mentally, you protect yourself in ways that matter most. Your health is yours to guide. Ask questions, stay informed, and prioritize what actually improves your life, not just what looks good on paper. Aging with wisdom means living fully, confidently, and joyfully without being trapped in a cycle of unnecessary medical tests. So take control, choose wisely, and make every year after 70 a year of strength, vitality, and independence. Because the goal isn't just to live longer, it's to live better. If you want, I can also create a time-stamp breakdown and pacing guide so this script naturally fits into a 40-50 minute narration for YouTube. This ensures smooth delivery, pauses, and emphasis for storytelling. Now, let's take everything we've discussed and turn it into a mindset shift, a way of thinking about health after 70 that puts you in the driver's seat. Part 8 is all about empowerment. First, remember this: your age does not define your health choices. Just because you're over 70 doesn't mean every test, scan, or procedure is automatically necessary. You have the power to say to what truly benefits you and no to what may cause unnecessary harm. Understanding this distinction is the foundation of smart, safe aging. Next, focus on prevention through lifestyle, not just technology. Walking, stretching, balanced nutrition, and social connection are not optional extras. They are your frontline defense against disease and decline. These daily habits often do more for longevity, energy, and quality of life than dozens of unnecessary tests combined. Part 8 is also about mindful healthcare decisions. Keep track of your health trends, ask questions, and always weigh the benefits versus the risks of any test or procedure. This isn't about being skeptical of doctors, it's about being informed and advocating for your well-being. The best healthcare is a partnership where you and your medical team make decisions together, guided by your priorities and values. Finally, embrace a mindset of quality of life over quantity of tests. After 70, the goal is to live fully, confidently, and independently. Avoiding unnecessary checkups reduces stress, prevents complications, and leaves more energy for the activities and relationships that truly enrich your life. By combining awareness, smart medical choices, daily healthy habits, and a focus on mental and emotional well-being, you can take control of your health like never before. Aging doesn't mean slowing down or giving up. It means choosing the path that lets you thrive safely, happily, and independently for many more years.